Well, let's unpack this. We're officially in the final, really tense countdown to a potential government shutdown. And the situation, well, it's not just high stakes anymore. It feels like it's fundamentally changing how Washington does business, or maybe how it doesn't do business.
That's exactly right. That's the crucial takeaway here. The statutory deadline for funding the government is rushing towards us. It's midnight Tuesday, so, 12:01 a.m. Eastern Time on Wednesday, September 30th. That's the cliff. And as we look at the source material, drawing from CBS News, CNBC, Fox News, the conclusion is pretty stark. This isn't just political brinksmanship. It feels like a really deep-seated political, ideological stalemate. And it's backed by threats that are, frankly, unprecedented in their severity.
Right. So our core mission today is to cut through all that noise. We want to give you a real deep dive. We need to define exactly what's causing this paralysis. Because it's not just about spending levels, is it? It seems to be about these very specific policy riders sort of hidden inside the funding bill. And we also have to really analyze these new, quite extraordinary implications this shutdown threat carries for, well, hundreds of thousands of federal workers. Because this time, the potential consequence isn't just temporary inconvenience, it's permanent job loss. So that's different.
It's completely different. And the environment right now is just defined by extreme urgency. The immediate state of play, well, as of Sunday, President Trump himself made it pretty clear. He told CBS News negotiations were at a stalemate, flat out. And he said unequivocally that a shutdown appears likely unless the Democratic leadership backs down on their demands over health care.
Right.
When the president uses language like likely, almost certain, about a shutdown, the policy gaps are incredibly wide.
That really defines the conflict straight away, doesn't it? We're not just talking about, minor squabbles over discretionary funds. The president has explicitly put healthcare policy right at the center of this whole standoff. So for you listening, understanding this pressure cooker means grasping these two kind of inseparable things. First, the intense, very specific policy disagreement over the future of federal healthcare funding, and second, the direct, severe implications for the federal workforce that are now being used as leverage.
And crucially, lawmakers in Congress, they remain far apart on negotiations. That's the reporting. With less than, 72 hours to go now? Historically, at this stage, you'd expect to see frantic backroom dealing, compromises being hammered out. But the recent activity, it suggests a really high degree of entrenchment on both sides, which makes the path to even a short-term funding bill, a continuing resolution, incredibly difficult.
Yeah, it feels different. Let's maybe look at how the negotiation landscape itself got so combustible recently, because the political maneuvering really set the stage for this deep policy block we're seeing now. The process actually seemed to break down pretty spectacularly just last week.
It really did. And the flashpoint, the turning point, was President Trump's sudden cancellation of that scheduled meeting last Thursday. This meeting was supposed to be the key session. At the top Democratic leaders in Congress, Chuck Schumer, the Senate Minority Leader, and Hakeem Jeffries, the House Minority Leader.
And he didn't just quietly postpone it. He went public, big time. He used his platform, Truth Social, to launch this really sharp attack, blasting Schumer and Jeffries for pushing what he called radical left policies that nobody voted for. That was his framing. And his conclusion, that no meeting with them could possibly be productive, that didn't just cancel the talks. It felt like an instant declaration of hostilities, framing the Democrats as the ones who were being unreasonable, the sole obstructionists.
And this move, it was reportedly influenced by his own party's leadership, too. The source material suggests that House Speaker Mike Johnson actually encouraged President Trump to cancel that meeting. And the strategic rationale Johnson apparently offered was, compelling, but also pretty risky. He basically said the president should only meet with them after they've done the basic governing work of keeping the government open.
Okay, hang on. Let's pause and think about that political move for a second. Johnson essentially told the Democrats and kind of signaled to the president publicly that negotiating terms before the funding was secured was somehow illegitimate. But doesn't canceling a scheduled negotiation meeting itself feel like, avoiding the basic governing work? Isn't negotiation part of governing?
It absolutely creates a strategic paradox, doesn't it? On one hand, yes, the Republicans are trying to shift the burden. They're saying, look, the Democrats are the ones threatening a shutdown just to force through these unrelated policy demands, these dirty riders, as they call them. But on the other hand, negotiation is governing. It's inherent to the process. So by walking away, the Republicans risk owning that narrative of inflexibility. Especially with the clock ticking down so fast, it felt less like a strategy to foster immediate compromise, and more like a high-risk gamble to pressure Democrats into passing a completely clean funding bill first.
A gamble that, well, seemingly failed because it forced this rapid pivot, right?
Yeah.
It led directly to the scheduling of this high-stakes bipartisan meeting on Monday, which, by all accounts, looks like the absolute last-chance saloon for finding some kind of resolution before Wednesday morning.
Exactly. That Monday meeting became the emergency pivot point. The president agreed to meet, but this time with a wider bipartisan group. So that meant bringing Schumer and Jeffries back to the table, yes, but now alongside the Republican leadership. Speaker Mike Johnson and the Majority Leader John Thune, just having that full leadership spectrum involved signals a recognition, perhaps, that this crisis can't be solved through just, one side's political posturing.
And the Democrats, they jumped on that opportunity, didn't they? They quickly confirmed they'd be there, but they also used it to reinforce their own narrative. Schumer and Jeffries put out that joint statement promising they'd meet anywhere at any time to negotiate a bipartisan deal. But notice the language they used. They stressed avoiding a shutdown, yes, but they immediately linked this for a deal to their intent to address the Republican health care crisis.
That linkage is absolutely everything. It's tactically crucial. By framing the talks around the Republican healthcare crisis, they're making sure those policy writers, the real sticking point, can't just be brushed aside as, peripheral demands. They're essentially arguing that the only way to govern, the only way to avoid a shutdown, is to actually address their specific policy concerns about the ACA, the Affordable Care Act.
Which rolls right into the political blame game, naturally. Democrats, using that joint statement, basically laid the potential shutdown squarely at the feet of Trump and the Republicans. They argued GOP leadership initially refused to even talk with Democrats, pointing right back to that canceled meeting.
Right. And meanwhile, Trump fired back, saying he'd only meet if they agreed to the principles he'd outlined in this letter he sent earlier. He demanded they do the right thing, very strong language. This whole dynamic, it just underscores a fundamental truth about shutdown politics, doesn't it? The fight is almost never really about what happens in the meeting room. It's about controlling the public perception, the terms of the negotiation. Both sides desperately need the American public to believe the other party is the one being unreasonable, the one holding the government hostage. And now, federal livelihoods, too.
Okay, let's shift gears now. Let's move from the political theater, if you will, to the actual policies that are fueling this standoff.
Yeah.
Because this is where we really need to dig in. The details of this policy writer battle, they are explicitly what's driving this shutdown risk. And they are complex.
Yeah, and what's fascinating here, truly fascinating, is that the shutdown isn't just about, say, the big top-line numbers, defense spending versus domestic spending, that kind of thing. It is fundamentally about these specific high-stakes healthcare policy mandates, these riders being attached to a must-pass funding bill, the continuing resolution.
Okay, let's pause right there for a sec, because for you listening, that term, continuing resolution, or CR, is absolutely key. Can you just quickly explain what exactly a CR is and why it becomes this battleground for these so-called riders?
Sure. A CR is basically Washington hitting the snooze button on the budget process. That's a simple way to think of it. It's a stopgap funding measure. It allows the government to keep running, usually at the current funding levels or maybe slightly adjusted ones, but only for a defined short period. Maybe it's 2 weeks, maybe 6 weeks. The whole point of a CR is supposed to be just continuity, right? Keep the lights on while the bigger permanent budget deals are worked out in Congress. However, because it is a must-pass piece of legislation, if it fails, the government literally shuts down and becomes the ultimate vehicle for leverage.
Got it. So if you have a controversial policy you really want to get into law, you try to attach it, like a rider on a horse, to the one bill Congress absolutely has to pass to avoid chaos, which is exactly why Democrats immediately started arguing that the short-term CR backed by Trump was dirty because it contained these partisan policy riders.
Precisely. And the core Democratic concern, their central argument against this dirty CR, it centered almost entirely on the future of the Affordable Care Act, the ACA. They argued the Republican CR continued what they framed as the Republican assault on healthcare, specifically by ignoring this immediate pressing issue of expiring ACA premium subsidies.
Okay, let's get granular on those ACA subsidies for a moment. Why exactly are they expiring now? And what's the immediate consequence the Democrats are claiming could actually lead to hospitals closing? They threw around a big number, didn't they? Something like $32 billion.
Yeah, that's the figure they're using. The subsidies, they're tied to specific funding authorizations in the law, but those authorizations were short-term, and they lapse if they aren't actively renewed in this funding bill in the CR. Now, these premium subsidies are absolutely essential because they make health insurance affordable for millions of low and middle-income Americans. They directly reduce the monthly premium costs people pay, and they also lower out-of-pocket costs, things like deductibles and copays, through what are known as cost-sharing reductions, or CSRs.
Okay, so if those subsidies just disappear, vanish overnight, millions of people suddenly face much, much higher healthcare costs instantly.
Instantly. Exactly. And when those costs jump dramatically, what happens? People drop their coverage. They simply can't afford it anymore. But the impact, it goes deeper than just individual affordability. It hits the whole healthcare system infrastructure, hospitals, clinics, providers all across the country, particularly those serving large rural populations or low-income communities. They rely very heavily on the certainty of getting reimbursed by the federal government, reimbursements tied to people using these ACA-backed plans. So that $32 billion loss figure, it isn't just an abstract number. It represents the estimated total financial hole that health providers, hospitals, clinics could face if those ACA credits and the associated federal payments that follow them suddenly expire.
And how does that specifically translate into actual hospital closures? What's the mechanism there?
Well, think about it from the perspective of, say, a rural hospital. Many operate on incredibly thin margins already. Now imagine a significant chunk of their patient base suddenly loses insurance coverage because their premiums just became unaffordable overnight. What happens to the hospital's reimbursement stream? It dries up fast. That sudden lack of revenue certainty, especially for covering essential services like emergency rooms or critical care, it forces really difficult choices. For many community hospitals, and especially rural healthcare facilities that depend on a certain patient volume and stable funding for high-cost treatments, losing that $32 billion in financial flow, as Democrats argue, could absolutely trigger insolvency. It could force closures in communities all across the country. So they're framing this as nothing short of a national healthcare catastrophe, directly caused by what they see as Republican indifference to the ACA's infrastructure.
Wow. Okay, that paints a very stark picture. It certainly provides tremendous leverage in these negotiations. But of course, Trump and the Republicans, they have equally specific and forceful counter-arguments, right? They weren't just saying no to the Democratic demands. They were actively attacking the Democratic proposal itself, arguing that their bill would cause its own kind of structural harm and actually reverse previous legislative victories the GOP felt they had won.
That's right. And that's where this policy conflict becomes truly deeply fascinating, because it's fundamentally a battle over two completely different visions for federal healthcare spending. You have the Democrats trying to inject new funding to stabilize the ACA as it exists now, and then you have the Republicans fighting fiercely to protect specific cuts they previously mandated, cuts aimed at controlling the long-term growth of federal spending.
And the centerpiece of the Republican defense seemed to be protecting the cuts linked to the president's prior legislative goals, particularly around Medicaid. Is that right?
That's exactly right. President Trump specifically attacked the Democratic spending bill because, from his perspective, it would essentially allow for the repeal of nearly $1 trillion, that's a trillion with a T, in previously enacted or proposed Medicaid cuts. Cuts that were a core part of his own legislative agenda, what he often referred to as his big, beautiful bill. Now, that big, beautiful bill was never fully enacted as one single piece of legislation, but these proposed cuts represented a major structural shift in federal healthcare philosophy, away from open-ended entitlement.
Okay, $1 trillion in cuts. It's a colossal figure. What specifically were those cuts targeting? How do you get to $1 trillion?
Well, achieving $1 trillion in savings over 10 years requires really systemic changes. These weren't just, trimming administrative waste around the edges. The core idea centered on fundamentally reshaping Medicaid, moving it away from being a federal entitlement program where the government pays a set share of costs for everyone eligible, and moving it towards a system potentially based on block grants given to the states, or maybe per capita caps. Now, this would give states much more flexibility in how they run their programs, which Republicans argue fosters innovation and efficiency, but it would also cap federal spending. And that cap, almost by definition, leads to reduced overall federal payouts over time. And consequently, that translates into cuts Cuts to specific services offered, cuts to who is eligible for the program, cuts to the rates paid to doctors and hospitals, all adding up over a decade to that massive $1 trillion figure. So for Republicans, protecting these planned cuts represents fiscal discipline. It represents structural reform of an entitlement program they see as unsustainable. For Democrats, naturally, repealing those potential cuts is about protecting vulnerable populations, low-income families, seniors, people with disabilities from losing access to necessary care. Totally different worldviews.
And beyond those huge structural cuts to Medicaid, Trump also zeroed in on a very specific, tangible program, the Rural Hospital Fund.
Exactly. He hit that point hard. He blasted the Democratic CR proposal for, in his view, specifically ending a massive $50 billion rural hospital fund. This fund was a key element of his earlier healthcare policy agenda. And it was specifically aimed at trying to stabilize those critical access hospitals and other rural health networks that are often struggling with low patient volumes, older infrastructure, and difficulty attracting staff.
Okay, so if we try to maybe compare the two sides' core demands using an analogy, you've got the Democrats really focused on preserving the immediate affordability structure of the ACA, those premium subsidies that keep millions of people insured right now, that's their priority. And then you have the Republicans focused on protecting these key structural provisions they favor, like that $50 billion rural hospital fund, and also fiercely defending the massive budgetary restraints they had previously planned or mandated through those potential Medicaid cuts.
That's a good way to put it. And if we connect this to the bigger picture, you see, the conflict is fundamentally a zero-sum game over the direction of federal healthcare funding. It's really a battle between the political left, prioritizing broad coverage and accessibility, mainly through the ACA infrastructure, and the political right, prioritizing fiscal responsibility, structural reform via Medicaid spending caps, and these specific targeted funds for constituencies like rural areas. And the thing is, both sides can make a pretty convincing argument that the other side's position will lead to catastrophic healthcare outcomes for Americans. Just, for different groups of Americans, depending on which policy you prioritize.
Yeah, that level of detail really shows precisely why these negotiations just collapsed, doesn't it?
Yeah.
When the core fight hinges on something like $32 billion in ACA subsidies versus defending $1 trillion in potential Medicaid cuts and saving a $50 billion rural fund. Well, there's just no easy middle ground there, is there? This deep policy struggle, it seems, is the fundamental reason the entire federal government is now staring down the barrel of a shutdown this week.
The policies absolutely are what got us to this point. But, as we mentioned right at the top, it's the unprecedented consequences now being threatened that make this particular shutdown risk truly unique and, frankly, quite alarming.
Okay, here's where it gets really interesting and maybe a bit scary. Because we need to pivot now from talking about policy writers to talking about personnel threats. Actual jobs. President Trump delivered a direct warning about the fate of the federal workforce itself, a warning that marks a profound historical break from how shutdowns have always worked before.
It's a major, major escalation. There's no other way to describe it. President Trump told NBC News on Sunday quite explicitly that if the government shuts down, we are going to cut a lot of the people that we're able to cut on a permanent basis.
Wow. Cut on a permanent basis. He did apparently follow up by adding that he would rather not do that, but the message itself was chillingly clear. This time, a shutdown means permanent job cuts. We are no longer just talking about temporary administrative pain for federal employees, delayed paychecks. We are potentially talking about career termination, effective immediately, for potentially thousands and thousands of people.
The political leverage that creates is just immense. You can imagine the pressure. And the White House immediately started doubling down on these warnings. They amplified the message, emphasizing that, yes, thousands of government jobs could genuinely be on the line if Congress doesn't reach a deal. This is being presented as a severe, calculated consequence, held directly over the heads of congressional lawmakers to create maximum urgency, maximum pressure.
Okay, let's really elaborate on the fundamental difference here, because it's crucial. The difference between the typical shutdown consequence we're used to hearing about and this threatened action. Can you break down the concepts of furlough versus firing in this context?
Yeah, the difference is absolutely night and day, and it's essential for you, the listener, to really grasp this distinction. Historically, when we've had full government shutdowns, think back to 2013, for instance, the standard procedure was furloughing employees. And according to data from the Committee for a Responsible Federal Budget, something like 850,000 federal employees were furloughed during that 2013 shutdown. It was huge.
Okay, and what does furlough actually mean, practically speaking, for those employees?
A furlough is essentially a mandatory, temporary, unpaid leave. The key word there is temporary. Furloughed employees critically, maintain their job security. Their benefits, like health insurance, remain largely in place. And crucially, Congress has historically always approved retroactive pay once the government reopens. So eventually, they get paid for the time they were forced off work. You can think of a furlough like being put on a forced unpaid leave of absence. You still have your desk, you still have your government ID badge, and eventually you get your paycheck back. It's a severe financial hardship, no question, especially for families living paycheck to paycheck. But the job itself is protected.
But the current threat involves permanent layoffs, actual firings. That changes the entire calculus, doesn't it?
Completely.
Yeah.
Absolutely. The threat this time is to execute mass firings. That means the permanent termination of employment. Your job is gone forever. And the administrative mechanism for this unprecedented threat, it was actually formalized by the Trump administration. It came through a memo released by the Office of Management and Budget, the OMB, and this memo explicitly told federal agencies across the government to begin preparing for these mass firings if Congress failed to agree on a funding deal by the deadline.
But how? What power does the OMB or the administration actually claim to have to enable permanent layoffs immediately upon a shutdown?
Yeah.
Doesn't firing a federal employee normally require a pretty lengthy administrative process?
With appeals and things? It usually does, yes. Which is precisely why this is such a significant break from all precedent. The OMB memo seems to hint at leveraging specific, perhaps obscure legal mechanisms, often related to budget shortfalls in a process known as a reduction in force, or a RIF. Now, normally RIFs are lengthy bureaucratic procedures. They involve seniority rules, bumping rights, appeal processes. But the administration might be preparing to argue that the unprecedented lack of funding caused by a prolonged political shutdown grants federal agencies emergency authority to implement RIFs immediately, perhaps based solely on critical mission needs, basically saying, we have no money, these functions aren't critical right now, so these jobs are gone.
Wow. So if the government shuts down on Wednesday morning, an agency head could potentially just declare a massive RIS, citing the permanent lack of funding authorization from Congress, and just start clearing out offices permanently.
That appears to be the implication. Precisely. That's the threat hanging in the air. So this isn't about temporary financial inconvenience anymore. It's about permanent career termination and potentially the wholesale dismantling of what the administration might deem non-essential government infrastructure and expertise. This permanent consequence, it just changes the entire dynamic for the federal workforce. It transforms the political failure of a shutdown from a temporary recoverable cost into a permanent structural human cost.
Which brings us to analyzing the pressure tactic itself. That OMB memo explicitly warning of potential mass firings, it served as a significant escalation of pressure, didn't it? Aimed squarely at congressional lawmakers to force them to head off a shutdown at any cost.
Oh, absolutely. It's the deliberate weaponization of the federal workforce. There's no gentle way to put it. Lawmakers, they're kind of accustomed to negotiating under the threat of furloughs. That happens. And furloughs generate public frustration, right? Because government services stop or slow down. National parks close. Passport processing slows. But the threat of mass firings hits a completely different, much more visceral nerve for every single legislator, because it means every senator, every member of Congress has to potentially go back to their state, their district, and explain why they allowed permanent, non-recoverable job losses for thousands of their own constituents, many of whom work right there in local field offices for agencies like the Department of Agriculture or the VA or Social Security. These are their neighbors.
And the potential scope here is just huge, too. You mentioned 850,000 were furloughed back in 2013. If this threat of firing is real, are we talking about similar numbers, or would it be a subset of those?
We're likely talking about a very large subset, yes. It wouldn't be everyone, of course. You still have essential personnel air traffic controllers, border security agents, active duty military. They're typically retained during a shutdown. Although, crucially, they also face the financial strain of not getting paid during the shutdown, even if they have to work. But that category of non-essential federal employees, it is vast. Absolutely vast. It includes people like research scientists at NIH or EPA, program administrators across dozens of agencies, regulatory staff, administrative support personnel. Nearly every agency has them. So if the Trump administration were to actually follow through on this threat, it could easily mean tens, maybe even hundreds of thousands of federal employees facing RAF notices, facing permanent job loss, not just a temporary lack of income.
This move just fundamentally rewrites the whole human cost equation of a government shutdown. Previously, the cost was measured in inconvenience for the public, delayed services, and temporary financial hardship for workers. Now, the potential cost is being measured in permanent damage to careers, livelihoods, and probably a significant drain of expertise from the civil service.
And that really is the core political insight here, isn't it? It shows how this permanent human cost, the threat to people's jobs and careers, is now being leveraged directly as a tool in political negotiations. Leveraged to try and force a compromise on completely unrelated policy riders that, as we discussed, are fundamentally about these deep structural disagreements over Medicaid and the Affordable Care Act. It puts every single member of Congress, Republican and Democrat, in a truly nearly impossible position.
And all of this immense pressure, all these complex factors, they're converging incredibly rapidly towards that Wednesday deadline. Let's just quickly recap the immediate situation as we look towards these final critical hours.
Okay, bottom line, time is running out. Fast. The central policy blockage remains fiercely entrenched. You have Democrats demanding the continuation of those ACA premium subsidies, arguing that failure risks this $32 billion financial hole that could shutter hospitals and clinics. Countering them, you have President Trump and the Republicans fighting just as hard to protect potentially $1 trillion in future Medicaid cuts and that specific $50 billion rural hospital fund. And politically, despite this dire warning of mass firings coming from the White House, both sides seem to be holding firm, at least publicly. Democrats are described as remaining resolute. Republicans are asserting that the Democrats are the ones being unreasonable. Stalemate persists.
So what does this all mean for the immediate path forward? What happens now?
Well, that meeting's scheduled for Monday, the one between the bipartisan leaders, Schumer, Jeffries, Johnson, and Thune, it really is the absolute final crucial attempt, the last chance, it seems, to find some kind of path towards a resolution. Likely, that would have to be a clean CR, or maybe one with very minimally dirty additions that both sides can somehow swallow. That has to happen before the Wednesday morning deadline hits. If they fail to find some action, some agreement, that failure immediately translates into responsibility. Responsibility for those unprecedented consequences we've been talking about, both the high-stakes policy crisis over healthcare funding and the severely heightened workforce implications, the mass firings, not just furloughs.
Which really raises an important question, I think, for you, the listener, to consider as you watch these dramatic events unfold in the coming hours.
Yeah, this race is a really critical question. Think about this. Historically, government shutdowns, while disruptive, were generally accepted by both political sides as a kind of temporary, painful, but ultimately reversible inconvenience. A pause button on government operations that could eventually be undone with retroactive pay for workers. But how does this new threat, the threat of mass firings, a measure that goes so far beyond that historical norm of furloughs, something that turns temporary pain into permanent structural damage, how does that change the fundamental political calculation for lawmakers? Does escalating the consequences on federal workers to this degree actually increase the likelihood of compromise, simply because the human and political stakes become too terrifyingly high for anyone to want to own that catastrophe? Or, conversely, does it simply entrench the political positions even further? Does it make compromise harder as both sides dig in and blame the other for the sheer cruelty of the potential outcome? That is the fundamental strategic shift in the nature of shutdown politics that we are witnessing right now, in real time. Something to really mull over as this deadline rushes towards us.